Caleb started to get sick. We had him move to Duke, and he saw a team of specialists there, and they did some testing there and bone marrow transplant. They did 4 types of chemo. It was pretty radical treatment on this little guy. And he was inpatient for about 3 months there at Duke. Then was released from the hospital, but we had to remain in Durham for about 4 more months.
When patients and families call us, they are desperate. They are overwhelmed and don't know where to turn for financial help.
My husband and I actually were not able to work at that time, and it took 2 adults to give Caleb full-time, round-the-clock care.
We had some reserves because I had been working prior to that. But those reserves don't last very long when you're not working full-time.
The existence of NTAF was brought to my attention by my daughter as she was looking for additional financial support or any support that could help her with her situation of anticipating a kidney transplant.
While many of the costs associated with solid organ transplants are often covered by insurance, it's the ancillary expenses that aren't paid. Things like relocation, transportation, and medications.
The insurance company paid for a lot of his care, not all of it. The hospital bill from Duke is a little over $1.5 million right now. And that doesn't include all the medicines and things like that he's gotten since then, one of which is just a tube that looks like a tube of toothpaste, a cream that we go through once every 2 weeks. Is $500.
The government will pay for you, the government meaning Medicare, some form of Medicaid, for just 3 years. After that, you better have a means of raising funds in order to sustain yourself.
I didn't really know what to expect in terms of the financial burden that was going to be on our family and the stress that was going to cause.
NTAF provides a way for communities to rally together and, with our guidance, fundraise for patients' uninsured medical expenses.
When the referral's made to NTAF, the feedback is incredible. They're seasoned staff. They provide services for decades in the transplant community. The families are relieved. They feel that they've been empowered, and they have a plan.
We had gotten information about the NTAF in a packet that Duke University Medical Hospital had given us. We quickly contacted the NTAF and spoke with a very nice lady by the name of Joni Henderson.
The Ransers came to NTAF after being told by their social worker that they would need to do some fundraising for expenses that were going to be related to Caleb's bone marrow transplant at Duke University.
We knew immediately that we were not in this alone, which was, that was a very comforting feeling. Because that was a really hard time, a really scary time.
I was the one he called 2 or 3 times a week. We talked about Caleb's condition always, what was going on with the family, but we were friends, and it was that connection that sometimes got the family through the week.
You have communities that want to help their neighbor, want to help their friend back to health, but don't know how to do it.
The community is really so focused on this individual having a second chance at life. And providing that financial security long-term is everything.
We're there to make their job easier so that they can draw upon the resources of that community.
We actually had some really good friends that stepped up to the plate, that wanted to help, that knew Caleb and loved and adored him and loved our family. And the show, The Biggest Loser, had just, I think, aired its first season. And they did a spin-off from the show.
We conveyed in our Christmas greetings to our many friends and family throughout the United States of Kim's condition. And we were overwhelmed by the response.
Both of the biggest fundraising events that we had that were very successful, that were completely handled by the NTAF. If my memory serves me correctly, he raised close to $15,000. $15,000 is a lot of money when you're looking in your billfold and you've got a couple of dollars in your billfold.
We could focus on what was important at the time, and that was taking care of our son.
Without the NTAF component, it would have been a really devastating financial challenge for us as a family.
The stress of having a sick child was enough, but the stress of trying to provide and to make sure that we didn't lose our home and our vehicles, on top of taking care of a child that we knew had a good chance of not surviving, was a lot. And so the NTAF was as much of a social worker to me personally anyway, as the social workers were at Duke.
Every patient can benefit from fundraising, and NTAF is a valuable resource. We're happy to make those referrals.
An organization like NTAF is a huge blessing for our family.